Hello, it's Nigel Calvert. I'm one of the public health doctors at the Health Board. Just wanted to say a few things about COVID infection and the things we can do to prevent it, particularly as we move into the Christmas season. There's an awful lot going on, and I thought it would be helpful, to perhaps update people about three things in particular. One is about the rapid tests, the lateral flow tests, and their place in the whole system. Vaccinations, an update on vaccinations, very important, of course. And also to say something about face coverings, face masks. So the tests, they're simple to do, these lateral flow tests. It's a complicated sounding name. Some countries just call them a rapid test, which is probably better actually. Lateral flow just means that the fluid kind of soaks along some filter paper inside the device, a bit like a pregnancy test that many people will have seen. So the pros and cons, the advantages are that they're very quick and straightforward to do. You get a result quickly, but they're not quite as good at picking up infection as the PCR laboratory test. So the way you get around that is to do them frequently. So everybody should be testing, particularly before you go out, to a social event over Christmas. And if it is positive, then, don't go, unfortunately, and book a confirmatory PCR laboratory test as soon as you can. Vaccination, you'll have heard a lot about this new Omicron strain, which does seem to be escaping the protection, that the vaccine has offered so far to a certain extent. Good news though is that a booster and the booster campaign, so that's a third dose for most people, is really well underway in D&G. So I would encourage everybody who's had both of their primary doses to arrange to get a booster as soon as you can. It's going to take a couple of weeks to get the full effect, but it's going to provide a useful boost, to the protection that you've already got. There's loads of information on the Health Board social media pages about how to go about arranging to get a booster, either by booking an appointment or going to a drop-in. And then the last thing I wanted to talk about was masks. They are important. The misconception, I think, is that people think they protect themselves. Actually, they protect other people from an infection that you might be harbouring yourself. So if you cough or sneeze, with a mask on, then it doesn't spread the droplets. So therefore, other people in the vicinity don't get infected. So it is more to protect other people. The cloth covering, face coverings are perfectly good, but if you do use those, please remember to wash them regularly. I think some people just leave them in the coat pocket for weeks on end, which is obviously not the most hygienic of things to do. So best if you have several of them and kind of have them working in rotation. So, just in summary, there's an awful lot going on with COVID. We're all getting a bit fed up, with the restrictions and the effect it's having on our lives. But I think it's sometimes difficult, sometimes to see the wood for the trees. The way I look at it is it's a bit like road safety. There's lots of things prevent deaths and injury on the roads, seat belts, speed limits, drink driving laws, airbags, various things that all have an effect. And I think with COVID, it's very similar, vaccination, social distancing, working from home, wearing masks, and testing all play a part. And there's no one silver magic bullet, but, if we all do these things regularly, then it's going to help to keep things under control, and we can hopefully, get back to some kind of normality, as soon as we possibly can. So I hope that was a helpful summary. Anyway, thanks very much.